There are several big advantages to robotic surgery. One of these is much better visualization. With the three-dimensional camera system that's used with a surgical robot, we're able to get back where the action is and actually see things up close and in 3 dimensions that would be very difficult to see with normal technology. The other advantage of robotic surgery is the ability to manipulate and move instruments in very tight confines. A lot of our traditional methods to get back into the mouth and further down in the throat and work in those areas involve very long instruments that have limited movement capability at the working end. With the robotic instrumentation, there's an actual wristing technique. The instruments flex at an artificial wrist, which allows us much more movement and much more precise manipulation of tissues in very tight areas. I think the most important point with regards to robotic surgery is that it provides levels of cure equivalent to other forms of treatment, such as radiation therapy and chemotherapy, as well as open surgical procedures, but with much better long-term functional outcome expected. By functional outcome, we're referring to things such as swallowing, speech, those sorts of things that you rely on your mouth and throat to do for you that we oftentimes take for granted. These things are improved with transoral robotic surgery as compared to conventional techniques. Transoral robotic surgery is still a relatively new development in the head and neck oncology field. There are very few places in Florida offering transoral robotic surgery at this time. We are pleased to be one of the centers offering this technique at Winter Park Hospital, Florida Hospital Orlando, and soon to be at Celebration. The robot doesn't actually do the decision-making and movement. It actually takes the movement of the surgeon, which is transferred at the surgical console, and puts that into movement at the end of the instrument that is at the patient cart. That's the part of the robot that's actually at the bedside and holds the instrumentation in place. So the robot is doing the movement, and I guess you could say it's doing the surgery, but the surgeon is directing every move very precisely from the console. Traditional surgery for head and neck cancer can involve long hospitalization and recovery periods. In general, when we're addressing a large tumor in the mouth or back of the throat, in the past it required open approaches with incisions, sometimes involving splitting the bone of the jaw. As you can imagine, this would take a long time for recovery, and sometimes recovery of function such as swallowing was not complete. With robotic surgery, we're able to do the same sort of removal that we could do with the old open procedures, but doing this all through the mouth and with much less healing time. Most patients can leave the hospital within a day or two after most robotic procedures. Transoral robotic surgery currently is applied to cancers in the mouth and the throat as far down as the top of the voice box. This means we can remove cancers in the tonsil region, in the base of the tongue, as well as the epiglottis and upper part of the throat. We can also take care of some tumors that are difficult to remove by other means in the mouth itself. Dr. Ho and I are currently trained in transoral robotic surgery and providing this service in Central Florida.